Welcome to the University of Melbourne Veterinary Hospital. My name is Dr. Melissa Meehan and I was fortunate enough to complete my veterinary science training at the University of Melbourne. I'll be taking you on a tour of this world-class hospital and showing you some of the services that are available to you and your pet. It goes without saying that your pet deserves the best of care, and the University of Melbourne Veterinary Hospital has been caring for pets in the community for around 50 years. Every year the hospital treats over 20,000 dogs, cats, horses and exotic animals through its general practice, its referral practice, its equine centre and a 24-hour emergency and critical care service. The hospital is located in Werribee, which means it's easily accessible to both metropolitan Melbourne and the rest of Victoria. The hospital runs an additional after-hours emergency centre in Geelong. In fact, the team sees cases from all around Victoria, as well as interstate, due to their expertise and facilities. The hospital is even certified to human standards. Staff here use the most advanced veterinary technology and equipment in Australia. Vets, surgeons, nurses and support staff are leaders in their field, who provide the highest level of veterinary care whilst also engaging in continuing education to stay on top of the latest knowledge. The Veterinary Hospital's general practice is a service available directly to members of the public and their pets. The practice operates by appointment to provide consultations and treatment to cats and dogs, as well as exotic animals such as rabbits, guinea pigs, ferrets, rats and birds, and non-venomous reptiles. The team provides primary and preventative pet care, such as vaccinations, health checks, treatment of unwell animals, as well as referrals to our hospital specialists. The general practice team performs most minor procedures, while major surgeries are referred to the hospital's small animal surgery service. The general practice vets have access to diagnostic imaging and pathology services, which are conducted right here on site. Plus, there is 24-hour access to a range of specialists within the hospital, should further discussions, investigation or treatment be required. Having all specialists, nursing staff, support staff and equipment housed together on site is incredibly beneficial to the animals in the hospital's care and the peace of mind of their owners. The University of Melbourne Veterinary Hospital deals with some very complex cases and everyone works together for the best outcome. The Small Animal Medicine team offers specialist diagnostic and treatment services for dogs and cats with medical conditions. The team includes several board-certified specialists in small animal internal medicine. They provide expert, caring and compassionate advice and management for pets with cancer, cardiac or respiratory disorders, blood disorders, hormonal disease, as well as digestive and urinary disorders. The Small Animal Medicine team runs special clinics for senior pets and pets with urinary disease, gastrointestinal disease and diabetes. The team also provides an extensive array of services, including continuous glucose monitoring, 24-hour ECG recording, fluoroscopy and nuclear scintigraphy. The Small Animal Medicine section's endoscopy unit is one of the best in Australia. The team regularly performs minimally invasive procedures that result in large amounts of information being gathered on the urinary, digestive or respiratory tract, with less impact on pets. There is also a dedicated oncology area to safely administer chemotherapy. This results in a quick and comfortable process for pets with cancer. The Small Animal Medicine team understands the emotional impact when pets develop serious disease and work closely with owners to explore all aspects of care available. The Small Animal Surgery team here at the University of Melbourne Veterinary Hospital performs a wide range of soft tissue, orthopaedic, oncologic and neurological surgery. They have the equipment and expertise to perform minimally invasive keyhole surgery, thoracic surgery, abdominal surgery, reconstructive surgery, total joint replacement, complex fracture repair and neurological procedures. The surgery team is the only specialist small animal surgery clinic in Victoria with multiple board-certified specialist surgeons and includes a team member with further fellowship training in surgical oncology. Successful outcomes for complex surgical cases requires the coordinated effort of many specialists from different disciplines. The small animal surgery team works closely with other services within the hospital, including anaesthesia, small animal medicine, emergency and critical care, diagnostic imaging and nursing, to provide complete and high-quality care for our patients. The team is fully versed in the assembly and use of specialised equipment, such as total hip replacement systems, internal plating systems, interlocking nail sets, spinal decompression units, cardiovascular instruments, and endoscopic equipment. They also boast a number of instrumentation equipment not available in most other veterinary practices. The team has special training and equipment to perform a range of minimally invasive keyhole surgeries. This allows for shorter surgical times and faster recoveries, the same as it does in people. The hospital has recently invested in a complete range of interventional radiology equipment. This extends the range of minimally invasive procedures the surgery team can offer, using real-time X-ray imaging, catheters and stents. The entire team understands the importance of follow-up care and advice, so our experience with you and your pet does not stop with just the surgical procedure. The neurology team, headed by a board-certified neurologist, treat a range of conditions, including intervertebral disc disease, inflammatory brain diseases, Wobbler's syndrome, degenerative myelopathy and brain tumours. The team also manages a large epilepsy caseload. The team liaises closely with the hospital's small animal medicine, small animal surgery and diagnostic imaging services to provide a complete referral service. They offer a comprehensive range of neurological diagnostic services, including EMG, nerve conduction studies, BAER testing to diagnose deafness and other conditions, comprehensive muscle and nerve biopsy procedures, and on-site CT and MRI scanning with a 1.5 Tesla machine. They have also recently acquired a frameless stereotactic device that allows them to accurately target lesions in difficult-to-reach locations and helps them navigate during brain surgery to more completely remove brain tumours. The fully equipped surgical suite within the veterinary hospital enables team members to perform sophisticated neurosurgical procedures, including spinal surgery, brain surgery, and the placement of shunts for the treatment of hydrocephalus when necessary. The Emergency and Critical Care Service at the University of Melbourne Veterinary Hospital provides care 24 hours a day, 365 days a year. They specialise in care and monitoring of very sick and injured animals, and those requiring technically challenging treatments. There's a vet and several nurses on duty at all times, so pet owners can bring their sick or injured animals to the ECC at any time of the day or night. Patients are examined and, if necessary, admitted to the hospital for further evaluation and treatment. The emergency and critical care equipment includes a state-of-the-art, purpose-built intensive care system to support patients with severe respiratory problems. It allows for a non-invasive control of oxygen, carbon dioxide, temperature and humidity, meaning it can be used for a guinea pig or a Great Dane. The ICU also has several ventilators and extensive experience in ventilatory support for patients with breathing problems, such as dogs who have been bitten by snakes. The team has more than a dozen vets, several of whom are board certified in emergency and critical care. That means that they've undertaken advanced training in the specialty of emergency and critical care. Together, our doctors have more than 100 years combined experience. We can provide the highest level of care and compassion to both animals and their owners. The University of Melbourne Equine Centre provides crucial specialist care to all types of horses, from performance horses through to ponies and even donkeys. The Equine Centre uses the latest medical and surgical techniques to treat cases that are referred from all over Australia, including lameness, surgery, gastrointestinal disease, respiratory disease, cardiology and neurology. The team also investigates poor performance and conducts pre-purchase evaluations. The Equine Centre has the largest number of equine specialists in Australia, including medicine, surgery, critical care, radiology, neurology, ophthalmology and reproduction. Equine treatments used at the hospital are evidence-based. The team benefits from access to the only high-field veterinary MRI unit in Australia, as well as computer radiography, scintigraphy, computed tomography, ultrasound, endoscopy and treadmill endoscopy. They are able to provide a high level of critical care to various and foals, including an on-site laboratory for 24-hour assessment and monitoring, qualified nursing staff and 24 hours a day care. The team pride themselves on their collaborative approach and their passion for the well-being of the animals in their care. The team of vets working at the University of Melbourne Veterinary Hospital need access to reliable and informative diagnostic imaging. The team of specialists at the hospital are leaders in their field, including several board-certified specialists. They have the most advanced suite of diagnostic imaging specialists and facilities in the Asia-Pacific region. Diagnostic services offered include radiography, ultrasound, nuclear scintigraphy, CT and MRI. Teleradiology and film reporting, PEN-HIP hip dysplasia radiography and interventional radiology services are also provided. Having a large team of veterinary radiologists and residents on site mean that patients receive specialised animal imaging services. The team are experts in optimising image quality and understanding the specific techniques required to apply imaging technologies to a range of animals, including snakes, budgies, seals, koalas, crocodiles, and of course, dogs, cats and horses. This is coupled with their expertise in anatomy and animal disease, which allows them to extract useful diagnostic information from each and every study. This is vital in ensuring the correct diagnosis and treatment. The correct administration and monitoring of anaesthesia and the management of pain are vital to animal well-being. The University of Melbourne Veterinary Hospital offers the only veterinary anaesthesia service in Victoria. The anaesthesia team provides crucial specialist anaesthesia and pain management care to the hospital's small animal, equine and exotic patients, from the most routine to the most critical, from the time of pre-medication and preparation through to their recovery in our wards or intensive care unit. The team has access to the latest anaesthesia machines and monitoring equipment, including state-of-the-art MRI-compatible anaesthesia and monitoring equipment, as well as anaesthetic gas agent analyzers. They also use the most up-to-date analgesic and monitoring techniques available, including those used in human medicine. Each hospital patient has its own dedicated anaesthetist, many of whom are board-certified specialists and frequently present at conferences worldwide. At the University of Melbourne Veterinary Hospital, there are several veterinary pathology laboratories which are staffed by experts in their field. Patient specimens are collected and delivered to the appropriate laboratory for immediate testing and rapid diagnosis of the patient. Delivery of laboratory services in real time ensures that patients receive the most efficient and appropriate care possible. The University of Melbourne is the #1 ranked university in Australia. As well as the important treatment undertaken here at the University Veterinary Hospital, there is also a strong commitment to training the vets of tomorrow. Veterinary science students gain exposure to all areas of the hospital under the constant supervision of qualified vets. Your pets appreciate the bonus cuddles, care and attention an extra pair of hands provides. And the hospital thanks you for allowing university students to be involved in the care of your pet, even if it's just to observe a consultation or surgery. We hope you have enjoyed this behind-the-scenes look at the important work undertaken here at the University of Melbourne Veterinary Hospital.